Hello, everyone. As most, if not all of you know, we are all unconscious. But what does consciousness exactly mean? Well, the definition most people use is consciousness is the state of being awake and knowing one's surroundings. But think about it. Let's say someone who has schizophrenia. Schizophrenia is a mental illness and it makes a person interpret reality abnormally. It may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs daily functioning. Well, people with this mental illness are awake. However, they do not have the genuine grasp of their surroundings. So, would you call them conscious? Truth is, people with schizophrenia have consciousness, but it is damaged. At least now you can see consciousness is more than just being awake and knowing one's surroundings. According to Thomas Nagel, an American philosopher, he said, a being is conscious just if there is something that it is like to be that creature, some subjective way the world seems or appears from the creature's mental or experiential point of view. In Nagel's example, bats are conscious because there is something that it is like for a bat to experience its world through its echolocatory senses, even though we humans, for our human point of view, cannot empathetically understand what such a mode of consciousness is like from the bat's own point of view. So now that you know about consciousness, let's talk about anesthesia. All around the world, anesthetics are used to prevent pain in surgeries and other procedures. But it's very weird. Let's say in a surgery, I'm getting my arm chopped off, pretty much, and I'm knocked out with anesthetics. I'm sure all of you are not thinking that I'm going to die because I'm knocked out with anesthetics, but think about it. If we did not have anesthetics and they chopped off my arm, I would most likely just die. A research that I found was made by many people who have studied the brain and are at a high level in their profession. The schools that reviewed this research paper were the University of Michigan and Harvard Medicine School. This research paper was about exploring general anesthetics being a probe to explore consciousness. The researchers said for their conclusion that the relationship between general anesthesia, brain function, and consciousness mechanisms is complex. As a matter of fact, anesthetic agents do not blunt out brain function globally, but exert specific and dose dependent effects on brain systems that sustain internal consciousness and perception of the environment. Each agent has its own mechanism of action and dose dependently induces distinct phenomenological altered consciousness states. In that respect, general anesthesia can be considered as a flexible probe to explore consciousness. General anesthesia aims at providing patients with a state where they can tolerate unpleasant/harmful interventions, usually during a surgical procedure. Routinely, this involves a cocktail of medications, ensuring an alteration of consciousness, somewhat like a hypnosis with absence of awareness of the surrounding environment, explicit recall of undercurrent events, a limitation of the stress response to sensitivity, as well as immobility. Anesthetic drugs cause brain circuits to change their oscillation patterns in particular ways, thereby preventing neurons in different brain regions from communicating with each other. The result is a loss of consciousness. General anesthesia does not shut down the brain globally and does not always produce a complete absence of consciousness. Similarly to disorders of consciousness in patients suffering from a severe brain insult, consciousness may be altered to various degrees, and its alteration may concern different consciousness elements as a function of the equilibrium between the inherent pharmacodynamic properties of anesthetic agents, their concentration in the body, and the intensity of the underlying stimulation by surgery. Connected consciousness in anesthesia refers to the subjective experience of self and perception of information from the environment, which may happen in episodes of variable duration and are not that rare. Whereas disconnected consciousness refers to internal awareness, connected consciousness refers to both external and internal awareness during anesthesia. External awareness is defined as the perception of environmental sensory stimuli, and internal awareness refers to all environmental stimuli dependent thoughts, autobiographical memories, or mind wandering. There are four different types of anesthesia. The first one is local anesthesia, which is used for procedures such as getting stitches or having a mole removed. It numbs a small area and you are alert and awake. Next is regional anesthesia, which is often used during childbirth and surgeries of the arm, leg, or abdomen. It numbs a large part of the body, but you remain aware. Then there is IV/monitored sedation, which is often used for minimally invasive procedures like colonoscopies. The level of sedation ranges from minimal, which is like drowsy but able to talk too deep. And finally, there is general anesthesia. Is used for major operations such as knee replacement or open heart surgery and causes you to lose consciousness. Mainly, we're here to talk about general anesthesia. So, what are the steps for taking general anesthesia? General anesthesia is administered by an anesthesiologist through a mask or an IV placed in the vein. The effect of the anesthesia should take place very quickly and you should feel lightheaded. And then, bam, you're knocked out and asleep. Then, just like that, your operation is ready to go. Now, there is one general anesthetic called propofol. It is one of the most widely used general anesthetics. What it does is it enhances the activity of the neurotransmitter, which is an inhibitory neurotransmitter that reduces neuronal activity and promotes relaxation. Additionally, this anesthetic is used for intensive care unit patients, and it decreases consciousness and a lack of memory for events. Anesthesia prevents so many problems and dangers. However, it does not mean there is zero risk. In fact, surgery and anesthesia are inherently dangerous, and with many medications or procedures, there is always a chance something can go wrong. Certain patients are more likely to experience problems or complication, and possibly even death. The factors that make anesthesia riskier are allergies to anesthesia, diabetes, heart disease, high blood pressure, kidney problems, lung conditions such as asthma, obesity, obstructive sleep apnea, stroke, and if you had seizures or other neurological disorders. Also, smoking and drinking increases your risk, so don't do drugs. Most of the side effects are minor and temporary, such as nausea, vomiting, chills, confusion for a few days, and a sore throat caused by a breathing tube. However, though rare, there are some serious risks to be aware of. First one is called postoperative delirium or cognitive dysfunction. This condition can result in long-term memory and learning problems in certain patients. It's more easily in older people because the aging brain does not recover from anesthesia as easily. Second one is called malignant hypothermia. This is a serious, potentially deadly reaction to anesthesia that can occur during surgery. It causes a quick fever and muscle contractions. Third is breathing problems during and after surgery. Patients with obstructive sleep apnea, a condition that causes them to stop breathing while they sleep. In patients with this condition, anesthesia can cause the throat to close up during surgery and make it more difficult to regain consciousness and take a breath after surgery. Okay, now you definitely know about consciousness and anesthetics. Thank you for watching. Bye bye.